last 2.5 days, you people would have discussed at length the various biomarkers and gone deep into the molecular biology. But I am going to present a very simple study, a simple cross-sectional study that has found there's an important reason behind carrying out this cross-sectional study, because there are a lot of cancer patients who come to our tertiary care center who use alternative systems of medicine, but they don't reveal it to the treating physicians at all. The doctors are kept in dark about it, and we do not know why is that the treatment outcomes are bad. But anyway, the background information is that in the last 15 years, the use of complementary and alternative systems of medicine has actually increased. And you can see that it ranges from 14.8% to 73.1% across various countries. And speaking specifically about Asia, you can see that in China there is one reported study which says 93.4% are using some forms of complementary and alternative systems of medicine. Mainly because cancer patients think that it's an incurable disease, and they would do anything to cure themselves. And in Thailand, there's a published study which says 60% of the cancer patients use some kind of alternative systems of medicine. Now, there are many reasons that are quoted in the review of literature, but three main reasons that have been highlighted are that complementary and alternative systems of medicine directly helps in fighting cancer, and then there are people who use it as an adjuvant. That is, they don't tell the treating physician, they are using the allopathic system, and in addition to that, they are also using various complementary systems. And there are people who use complementary system just to reduce the side effects of the allopathic treatment. So these are the three predominant reasons for use of complementary and alternative systems of medicine. So we did this simple cross-sectional study just to know in our hospital what's the proportion of patients who actually use the CAN. And we also wanted to know the patterns of usage and to know the reasons and perceptions which actually made them prefer the complementary and alternative systems of medicine. So this was an interview-based cross-sectional study, and ours is a tertiary care cancer hospital which treats all the cancer patients from South India. And our study population consisted of all the cancer patients who came to our hospital. We used a sample size calculation formula for 95% confidence interval, and for 80% power, we assumed 10% non-response. We got a sample size of 144. And of course, in these kind of studies, we can't do a random sampling. It was a non-random sampling. So anybody who consented, we interviewed them, and we basically obtained permission from our institutional ethics committee and also institutional research committee, and we conducted the interviews of the cancer patients who had come to the hospital. So we just sought their permission, and then we conducted these interviews. And here are our results. So totally 154 cancer patients participated in this study, and majority of them were in the age group of 41 to 60 years, and more than half of them were females. Most of them were married, and they had education up to secondary school, and they were skilled and semi-skilled occupations that they pursue, like tailoring, like stitching, and kind of stuff that's common in our area. And these are the three predominant cancer types that we got: breast cancer, followed by leukemia and esophageal cancer. There were others too. Now, most of them were diagnosed in the last 1 year only. It just happens that most of the cases that we got were the ones who were newly diagnosed, and most of them were on combination of chemotherapy, radiation, and surgery. But chemotherapy was the most common, and most of them said that they were satisfied with the treatment that they were getting. In our study, we found 33% of them were actually using complementary and alternative systems of medicine. It is slightly lesser than what the other studies have actually pointed out. And we found that Ayurveda is the most common use. Just in case you people didn't know, those of you who are from India will already know this. This is a system of medicine that's based on using various herbs and shrubs. Okay, this has been practiced in our country for the last 5,000 years. There were other systems, but Ayurveda was the most important. And when we looked at the pattern of usage, most of them were recent users. That is, they started using it within 1 year. What they did was, they first tried the conventional treatment. They got diagnosed. We put them on chemotherapy, and within 6 months to 1 year, they started taking alternative systems on their own, but they never revealed it to the doctor. And we asked them whether they discontinued it. They said no. and they would recommend CAM to another person. They were satisfied, and most of them, it was not a supervised treatment. They were just trying out things on their own. And the predominant purpose that they stated was that they mainly used it as an adjuvant. Adjuvant meaning that they would want to continue with chemotherapy, but they also would like to try this in addition to that. So that was the most important reason, and that was the most important purpose. And there are many reasons and perceptions that we got, but then there are only a few that I would like to highlight. Allopathic treatment is too expensive. Now it's a fact that you can have newer modalities of treatment, newer molecules, enzymes, but finally it's if people can't afford it, what they would do is they would take whatever that they could afford, and this is what we got. And they were just doing everything that can help them. So most of them perceive that it directly treats or cures cancer. Just in case you people didn't know, I come from an area where most of the cancer patients, they report to us that they got cured, and we have seen these kind of cases where they went to alternative systems of medicine, they got cured, and then they just came to us to confirm that there is no evidence of cancer in the body. We have seen a lot of these kind of cases in our field practice areas, and most of them, at least 38.5% of them believe that it boosts body's ability to fight the cancer. So I would say it's more in tune with their beliefs. They have heard about, okay, then we looked at those who were not using CAM. They said that they have heard about it, and but then they would say that those who are not using it, they would base their trust, they would trust the allopathic system and not the CAM. So we made an attempt to compare the users and the non-users, and this is what we found. So this, in my opinion, is the most important finding of our study. What's happened is, the moment they were put on chemotherapy, and within 1 year they started CAM. So we know from our study that if somebody attempts this alternative system of medicine, it's not going to be far away, it's just going to be within 1 year. So as soon as they are diagnosed, we put them on some kind of treatment, and within that time they are going to use. And what we learned from this was that one of the reasons is because they have very high expectations. Cancer patients have very high expectations about the treatment. In spite of whatever we say, they expect that the treatment should cure them completely, and when it doesn't happen or when they are not satisfied, that's the time they start trying out other things. So a little bit of comparison of our results with others. We found that ours was a slightly lesser usage as compared to others, mainly because if we had taken only one cancer type, we would have got a higher prevalence. So in all those reported studies where the prevalence of CAM is higher, it's because they looked at only one cancer type, either it's breast cancer or leukemia or oral cancer. But we included all cancer patients, so we got a lesser proportion. And we also found that the use of CAM is based on the local culture and beliefs. Okay, so in our study it was Ayurveda, it's because it's more in line with Indian belief. And most of them were just trying things that could help them. So these are our three important conclusions. That the proportion of use was 33% approximately, and majority of them were satisfied with allopathy, and then about half of them use CM as an adjuvant. Of course, in a study like this, there are two important limitations. One is response bias. It's very difficult to overcome, because I think that in any interview-based study, I don't think that it's possible to actually completely overcome this. We can actually reduce this. And of course, due to feasibility reasons, we conducted it in only one tertiary care center. But I can say that the impact of this is very less, because we treat most of the cancer patients from 3 states in South India. So I would like to acknowledge the participants for having been a part of our study, and I also thank our institutional ethics committee which approved this research, and these are my references. Thank you.
Thank you. Any questions?
Yes, you mentioned complementary means herbal. What type of, did you ask the question, what type of herbal they are using, neem or some other thing?
Okay, so what happens is most of these people are not educated enough to know what they are using. But we asked them questions for us to know what they are using. So we had given options like whether it's a herbal medicine, whether it's an Ayurvedic doctor. Ayurvedic, in our country, Ayurvedic system is just like an allopathic system. Like I am a qualified allopathic doctor, there are qualified Ayurvedic doctors as well. So we want to know, so we have provided them various options, like whether they went to a qualified Ayurvedic doctor. Then there are people in rural areas, villages, who call themselves as herbal doctors, and they also give. Now, most of these people who take these herbal medicines, they wouldn't know the names of, it's not possible. So we wanted to know what kind of systems that they were actually by using. So we didn't ask them, there's no way we can actually name the compounds because neither the person who gives knows nor the patient who take. But they do use some kind of herbal supplements.
Yeah, this information is very important. There are four good studies.
Yeah, I think when the government people going for Ayurveda is always being very close to
Yes, that's true. Yes. That's in fact I completely agree with that. One of the reasons why we got most of them did not tell this is because there is an inherent limitation in our study. We conducted this study on cancer patients who have come to our hospital. Now what happens is, suppose if I am the treating doctor and if the patient has come to my hospital, it's very unlikely that they would actually quote something that are against the allopathic system. But if we had gone to their house, probably they would have told the same thing that you said. So that's one inherent drawback. But I do agree with you because a lot of cancer patients with whom we have interacted in the clinic, they tell the same thing. They say that your allopathy only manages the symptoms, whereas they believe that this alternative system somehow cures the cancer from within.
I think so all the diseases we always thinking that
Exactly.
so that the Ayurveda closes from the root.
Yes.
Allopathy is to the substance.
Yeah. Yeah, this is the kind of belief that has become very common in our country, and as you said, it's not just for cancer; it's for any incurable disease.
Yeah.
We have seen people, we have seen diabetics, we have seen hypertensives, and we have seen even obese. A lot of these people, including people who have had chronic renal failure and all, they have tried all this. For most of the, even including asthma, osteoarthritis.
And I think it matters so much upon your belief that
Yes.
you can get so cured
Yes.
that you moderate your epidemic accordingly.